Good afternoon, and thank you for joining us for our AGM on this blustery Somerset afternoon. For once, the virtual meeting has an advantage over trudging through the rain in Somerset. These are extraordinary times for the NHS, and it has been an exceptional year for YDH since we last met. Today, you'll hear from Jonathan about the year which we're reporting on, and from Sheila about our COVID response. I'm very grateful for the support we received from our Council of Governors, and we shall note their efforts and the support which has been admirably summarised by our lead governor, Alison Whitman. We shall conduct our formal business, receiving the annual accounts and the report, considering and I hope confirming a minor change to our constitution. And then we shall be joined on screen by the other members of the executive team and hold a question and answer session. I shall let Jonathan direct the questions, as he will know far better than I who will be best to answer them. On a practical front, the question and answer function will be available throughout the AGM. You can submit your question at any time. We will address them during the Q&A section towards the end of the meeting. At the same time, the approval and receipt of minutes and various papers will be conducted through the polling function on WebEx. We will tell you when this option has been switched on, and if you wish to take part, and I hope you will reveal the question and answer and polling panels using the buttons which can be found in the lower right-hand corner of the meeting screen. So first, we have to cast our minds back a year and confirm that we accept the minutes as presented of our last annual general meeting, which was held on Thursday, the 19th September at the hospital. Seems a long time ago. The minutes have been circulated. Do those who were at the meeting confirm that they are a fair record of what took place? The polling function is now available, and I'll give you a moment to cast your vote. I hope everybody's finding the button. First time out, I'll give you a bit of extra time. Okay, and the result of the poll is that the minutes are confirmed. Thank you very much indeed. I should now like to pass over to Jonathan, who will give us an overview of the year.
Thank you, Paul. It's my absolute pleasure to be here again as Chief Executive of Yeovil District Hospital. I'm going to talk about the last year, the last financial year, which runs from April 2019 to March 2020. But clearly since then, an awful lot has happened. An awful lot has happened across the whole of the NHS and across the whole of the country. So whilst I'm giving an overview of the previous year, we are going to pick up later on the hospital's phenomenal response to the COVID pandemic. And I just, as an opening point, wanted to pay absolute tribute to all of our staff here at Yeovil Hospital, but also our staff across the health and care system in Somerset, who have risen to the challenge and have shown great resilience through the first wave of the pandemic. We don't know what's going to happen next as we go into potentially a winter and a second wave. But I'm sure that staff will maintain that level of professionalism and level of resilience, and we'll certainly be doing all that we can to support them in whatever comes over the coming months. But what I'm going to do is, as usual, give you a quick fire recap of the year and on our year in numbers. But I wanted to just start by just recapping on our vision as a hospital. And so as a board, we've been working over the last year to progress this vision even further. Our mission is to care for every patient as if they're a member of our family. And I think that sums up the Yeovil Hospital ethos and the Yeovil Hospital desire to treat everybody as individuals. Underneath that, we set ourselves 4 strategic aims. Our vision and our strategic ambition are very simple: to care for our population and to move away from just providing care to people when they get sick and they need our traditional hospital services, but to support people and encourage people to live healthier lives in the communities in which they live. To develop our people, and I'll talk as we go through the presentation about some of the things that we've been doing over the last year to make sure that our individual staff, our teams have the skills, the capacity and the environment within which to provide the care that they aspire to, and to make Yeovil Hospital an employer of choice across the NHS. To innovate and collaborate, and again, one of the real impacts of the current pandemic is a whole heap of innovation and change that has been delivered in terms of the way that we provide services to our patients, and we really have moved forward with that agenda over the last 6 months, using new models of technology to deliver care in a really different way. And Sheila will talk about some of that when she comes to talk about the response to the pandemic. And fourthly, to develop a sustainable system in our local community, recognising that Yeovil Hospital doesn't sit in isolation from all of the rest of health and social care services. And there is huge opportunity for us to move forward and increasingly join those services together and ensure that we are able to sustainably provide services for our local population. So our vision and our mission is quite simple. And the last year, I think we've made good progress again in moving forward on all of those areas. So I'm going to whip through our year in numbers. So first of all, just to give you a bit of context, we saw just over 50,000 people who were admitted to inpatient or day case beds here in the hospital during the year. That included just over 3,000 children who we cared for. We saw 58,000 patients through our emergency department, and that represented a 4.5% increase in the number of patients seen the previous year. And I think before that, the figures I gave last year was something like a 9% increase in the previous year. So year-on-year growth through the emergency department. And not only are the patient numbers going up, but the acuity and the complexity of those patients is also increasing. We, in our maternity unit undertook 1,400 births in the year. And we also, just to give you a kind of bit of a sense, we mended 314 hip fractures and treated just under 500 patients who came to Yeovil Hospital with symptoms of a stroke. Just over 1,600 patients were treated for cancer diagnosis here. And we undertook just under 130,000 radiology tests. So that could be X-rays, it could be MRI scans, CT scans, so a range of different diagnostics, but 130,000 different tests were undertaken during the course of the year. And we saw 185,000 people through our outpatient department. And if I tell you that during the COVID pandemic, we've moved a significant proportion, I think just about 30% of all our outpatient appointments are now being done virtually, either through telephones or telephone or through video consultation. That represents a huge volume now in that total number of appointments. The NHS's performance is judged against a number of key national standards, and I just wanted to run by Yeovil Hospital's position against each one of those. So one of the key standards is the amount of time that it takes us to treat patients who are waiting for what we call elective procedures, so waiting on a waiting list for a planned procedure. The national target is 92%. We saw just about 90% of patients within that standard, and maintained our position as one of the highest performing trusts in the country. Despite the increase in the number of patients attending the emergency department, we were one of a small number of trusts that got very close to the 95% standard for A&E, and we were consistently in the top 3 for A&E 4-hour waits nationally. And I think that goes to show, again, within the context of that increasing demand, the amount of work that both the emergency department, but actually the whole of the hospital and the whole of the health and care system has done to help support that. This isn't just about an ED standard. This is about the whole hospital rising to the challenge of making sure that patients get the right quality care in the right place at the right time. We had 86% of our patients were seen within 2 weeks of referral for a suspected cancer outpatient appointment. And of those, 86% received their treatment within 62 days against the national standard of 85%. And this is really the key standard in in cancer treatment because it represents the whole treatment and diagnosis pathway for those patients who have a confirmed cancer diagnosis. So we are incredibly proud that we're able to hit and achieve that standard here at Yeovil. And we achieved good standard in terms of our diagnostic testing. Our radiology services performed incredibly well through the whole of the year. During the year, we had a couple of issues in a couple of areas, in audiology and occasionally in echocardiography, which meant that we were slightly below the standard. But again, a really good performance in terms of the number of patients getting their tests within 6 weeks. Just on clinical quality standards, one of the ways that we assess the quality of care that is provided by the hospital is against something called the hospital standardised mortality ratio. And to give you a sense, a 1 score is in fact the anticipated score based on the demography and the age profile of your population. So a score of under 1 means that you're doing statistically better than the national average. A score of over 1 is a little bit worse. So we were in a place where our hospital standardised mortality ratio is better than the national average, which is a really positive indicator of quality of care. We also are really proud of the strides that we've made in infection control. We had 0 MRSA bacteremias last year. We also made massive strides and low levels of C. diff infection, and across all of the infection control metrics, that we were in a really good place. And clearly, as we move into a new world of infection control that relates to our response to the pandemic, I think the strength of our infection control team and our infection control support mechanisms here are something that stands us in really good stead for whatever comes over the coming months. We had a low level of pressure ulcers across the hospital. And again, if you put that, I think, within the context of the 50,000 patients who had inpatient care here, this is a relatively small number. But again, we're not complacent about that. And behind every one of these patients, there's a story, and we have a really good way of being able to learn any lessons that we need to learn, consistent in terms of numbers on the previous year. And again, our number of patient falls, which resulted in moderate harm to patients, was again low within the context of the total number of patients that we saw in the year. But again, for each one of those 9 patients, there is learning, and I think it's important that learning is fed back on each occasion. And we had a low level of formal complaints. Again, the number of patients that are coming through our hospital, either as inpatients, as attenders to the emergency department, as outpatients, or for their diagnostics. 52 formal complaints is a relatively small proportion. I have to say, though, sometimes where we get it wrong, we do get it wrong, and each one of those also gives us an opportunity for an investigation, a review, and learning out of that. So we don't take our complaints because the numbers are low. We're not complacent about that because there's learning in each one of those cases. From a staff perspective, we have 2,459 whole-time equivalent staff across Yeovil Hospital and Yeovil Hospital Group, which is including Symphony Healthcare Services and Simply Serve Limited, which I'll come and talk to in a moment, both of our subsidiary companies. Last year, we recruited 59 new doctors and consultants who joined us here at Yeovil Hospital, and 50 new nurses across all elements of the hospital. Our nursing vacancy rate at the end of March was just 1.2%, and I think there aren't many hospital chief executives who can sit in their AGM and talk about a registered nurse vacancy rate as low as that. And where we have vacancies, those vacancies tend to be in specialist areas, so in theatres and in ICU. So we're really focusing on that. The ward nursing establishment is good and consistently good. One of the reasons that it is so good is because of the work that we've been doing to develop our overseas recruitment offer. This has really gone from strength to strength, and it started 10 years ago with us starting to develop a relationship with the Philippines, which has then developed into a much more sophisticated recruitment offer now, where it's a very personalised recruitment offer focusing on Dubai and the Philippines. And that has enabled us to not only recruit a significant number of staff from overseas into the vacancies at Yeovil Hospital, but we are also now supporting 19 other trusts across the country and have recruited more than 1,000 nurses. In addition, we're now branching out into radiographers, and again have made a commitment to recruit 100 radiographers for the NHS in the South West. I think we've been recognised as the lead recruiter for overseas recruitment in the South West, and have been talking nationally about some of the work that we've been doing. What we've also seen as a result of that is an improvement in our retention rate. So our staff, not only were we able to recruit more staff, but staff that are here are staying. And they're staying, I think, because our rotas, we're able to offer slightly different rotas, more flexibility on rotas for staff, because we're not constantly asking people to fill gaps on vacancies. In terms of the National Staff Survey, I'll come and talk about that again in a moment. But again, we had a really good response rate to our staff survey in 1920. I think the people element of the work that we do here, and our culture, which was represented a year ago really by the Care Quality Commission when they came and did their inspection of us, really pulled out the strength of the culture here at Yeovil Hospital. I think during the last year, this has really been cemented by a number of accolades and a number of awards that we have won, both for our overseas recruitment, but also for the work that we've been doing around staff health and well-being, and general recruitment and retention across the whole of the hospital. So we're really proud about the work that we do for our staff and our staff support. And again, that came out in the staff survey. So every year there is an annual staff survey of the NHS, which asks staff to give us their feedback. We have a very open approach to that. We encourage the staff to fill that out in an honest way, because actually by getting that feedback, it enables us to identify issues from us. It's one of the tools that we have to identify issues from a staff perspective and action those. And actually over the last 3 years or so, we can point to some demonstrating actions that we took as a result of the previous year's staff survey to improve the offer and the support that we provide to our staff. In terms of some of the headlines from last year's staff survey, we had the highest response rate across the NHS, so 72% of our staff completed the staff survey. In itself, that's an indicator, but it means really that as a board, we have a statistically significant staff survey, which means that we can't hide behind a low response rate as a reason for not doing things. We had the third highest score of all trusts against overall staff engagement. And within that, we were the best trust in the NHS, or staff rated us as the best staff trust in the NHS for the initiatives that we were taking around health and wellbeing, which was really pleasing because health and wellbeing came out as a key area of focus in the previous year's staff survey. So to have made such progress over a year on that, I think was a real testament to the team and all the work that we've done on that front. We were also the best trust in the NHS rated by our staff for equality, diversity and inclusion, and for the support that staff felt from their immediate line managers. And I have to say, of all of the metrics really that we talk about as a hospital, these are some of the things that make me the most proud to be the chief executive of this organisation. We have, as always, some things to focus on. So we are focusing this year on strengthening our appraisal process, not just making sure that staff get an appraisal, but making sure that the appraisal that they have is of good quality. Making sure that we reflect a just culture in our HR policies so that we are fair and reasonable to staff. Implementing more health and wellbeing initiatives, and really never has this been more important. The focus on staff support during what is an incredibly challenging time for staff. We've got a good foundation to build on. There's always more that we can do. And appointing more freedom to speak up champions. The staff survey is one way that we feedback and get feedback from our staff, but there's lots of other ways that we need to do that. And freedom to speak up champions across the hospital is one way for staff to be able to have somebody that they feel confident and able to have that informal conversation, to raise an issue, to raise a concern, with, and they are able then to raise those issues with us as an exec team. Our financial performance for the year 1920 again represents a significant change on previous years. In year we hit a break-even position. This is a break-even position for the first time, certainly for the last 3 years. In fact, we posted a deficit position of £19.3 million, but that deficit was offset by financial support from NHS England. So in effect, we were set what was called a control total target, £19.3 million deficit. If we hit that control total, then we received £19.3 million worth of additional income that effectively got us to a break-even position. So we hit that with the support, and I think a phenomenal amount of work both internally but also support from the local health system in Somerset, which meant that we were able to bring another £19.3 million worth of cash into the Somerset system. So a really pleasing financial outturn for us. Just to give you a bit of a sense of where we spend our money, our operating income for the year was £195 million. We spend a big chunk of that on our staff, so £122 million on our pay bill for our staff. And within that, we generated just over £5 million worth of savings in the year, which again, we're required to do that to stay still and to keep on hitting those financial targets. We also invested just under £8 million in the estate, in capital. And some of these things are things that you don't see. We replaced the lifts in the women's hospital, for example, as a chunk of that money. A big element of that every year goes on us maintaining and replacing critical equipment, both in theatres and across the rest of the hospital. So this is sort of very much backlog maintenance. It's about keeping the hospital running. But one of the big things that we started in the year was the development of our key worker accommodation, which is a £17 million development just down the road from Yeovil Hospital, which will be up and running early in the new year, so early after Christmas. This is offering us 66 units of a mixture of 1-bedroom apartments to 8-bedroom apartments for our staff. A massive offer really, and recruitment and retention offer for staff within walking distance of the hospital. And over the course of the year, whilst the pandemic has been progressing and whilst we've been doing other things, it's been great to see this rising from the skyline in Yeovil and starting to really take shape. So we're really excited that early in the new calendar year, we'll be able to offer this facility to our staff to have consistent, good quality accommodation for them to rent and to come and be a key recruitment, an attractive recruitment tool for us here in the hospital. I talked earlier about our subsidiary companies, of which we have 2, and I was going to just talk a little bit about them. The Yeovil Hospital Group is made up of Yeovil Hospital, but also Simply Serve Limited and Symphony Healthcare Services, which I am going to talk in a bit of detail about. Daycase UK was an organisation which was a partnership model that we had that was running our daycase services, which we have made dormant this year. So that company no longer exists. So I'm not going to talk specifically about that. But I wanted to focus on both Symphony Healthcare Services and Simply Serve. Symphony Healthcare Services is a partnership that has been grown from Yeovil Hospital and the local GP practices. And this came out of, you've heard us talk in previous AGMs about the work that we were doing around this Symphony programme, which was about joining up and integrating care across acute hospital care and the local GP practices. Symphony Healthcare Services was born out of that and was an attempt to be able to support local GP practices who were having some challenges, maybe around recruitment or retention of GPs, and who wanted to find a different model for providing primary care that was supported at scale across our local system. So we established Symphony Healthcare Services, a wholly owned subsidiary of Yeovil Hospital and is a joint venture with primary care. It's now running 9 practices in 13 locations, largely in the South Somerset area, but not just in the South Somerset area. And is now providing care for just under 80,000 patients across their practice lists at the end of March. In terms of some of the achievements of Symphony, and I asked Symphony Healthcare Services to list some of these, and I think when you reflect on the progress that Symphony Healthcare Services has made, certainly in the last year, it has been phenomenal. Largely, the practices that Symphony has taken on have now delivered an improvement in their CQC ratings from requires improvement to good across the board. They've rolled out Ask My GP. It says there in 2 surgeries. That was in March, and I think since then there's been a significant increase in the number of practices that's been rolled out to nearly all of the practices now, as part of their response to providing primary care to patients in a different way in the kind of in the COVID environment. A new telephony system has been put in across the practices. They've achieved their financial targets and their cost improvement targets in the year. There's further to go to make the organisation financially break even, but they're on that journey. They've managed COVID across the practices, and they have procured a new HR workflow system that is supporting both the recruitment of staff and Symphony Healthcare Services in recent months has appointed and bucked the national trend and recruited 14 new GPs. So the GP vacancy across the practices that Symphony Healthcare Services is running now is in single figures, and with further developments to be made. And since March, they've also integrated another practice in the Exmoor part of Somerset. So very much developing, and I think offering primary care an alternative in Somerset that helps to stabilise primary care, and clearly also the synergies and the benefits of to the hospital of having stable primary care in our local area. Our other subsidiary is Simply Serve. Simply Serve is working across all of these various organisations, won a contract this year to provide services to the UK Hydrographic Office in Bridgewater, but also providing services to a number of other NHS organisations. There are 310 members of staff in Simply Serve, and this year we've undertaken a review. We set Simply Serve up a couple of years ago, and we've undertaken a review now 2 years in against the original aspirations of setting Simply Serve up. And I think it's fair to say that on every single one of the metrics, Simply Serve is outperforming where we even thought that it was going to be in those days when we approved the business case in the first place. And there have been a number of developments. They've increased the number of services that they are providing across. And there's a sense there of some of the things that they've been doing, but also a number of successes. And I'll just pick out a couple of these things because I think one of the big developments in the last year is halfway down that list. Our radiology managed equipment service with a company called Althea, which provides us with the next 10 years a clarity about how we provide our radiology services and our equipment and keep those up to date and world class as we move and as technology develops over the coming year. We also replaced our robot in our pharmacy, which again, if people have had the opportunity to see that, is a phenomenal development that helps both with the accuracy and the timeliness of prescribing and medicines prescriptions. And we had a robot before. We've now got a new state-of-the-art robot in there, and this is all thanks to Simply Serve. We replaced the lifts in the Women's Hospital, and you can see a number of other developments there that have happened across Simply Serve that have been a direct benefit to Yeovil Hospital. I just wanted to finish by talking about fundraising, because fundraising is a big part of our culture here at YDH. We received in the year donations from 3,200 individual people, and I think that in itself talks to the way that Yeovil Hospital is recognised and valued by the local community. Our big fundraising campaign has been for the breast care unit, and over the year we've received just over £500,000 worth of charitable donations to the Yeovil Hospital charity. A big part of that represents and supports our breast cancer unit appeal, and you can see some of the examples there. The people in the middle of that slide are our orthopaedic surgeons who undertook the 3 Peaks challenge earlier in the year. I think they thought it was going to be easy, as orthopaedic surgeons do, but I think it was rather more challenging than they possibly thought. But there they are, partway through that with smiles on their faces. And again, that's just an example really of how our staff, but our local community have got behind that appeal. And we've now reached 1.5 million of the £2 million target. So, and actually we were hearing today from our head of fundraising, who said that despite the fact that we've had a slight reduction in support during the kind of COVID period for reasons that people have been supporting other parts of our charity, actually now fundraising for the breast unit is starting to pick up again, which is really pleasing and means that as we go into the new year, we should be able to start to break ground on this development, which is going to have a massive impact for our patients. And this gives you a bit of a sense of what the charity does and the sort of things that the charity provides for us. And these are effectively all the value-added things, all the things that as a hospital we can't support from our day-to-day revenue budgets. But actually, with that amount of charitable support, these provide all the added extras that really can make the journey or the care of a patient just that extra bit easier. And in addition to the Yeovil Hospital charity, we also benefit from the fabulous support of our League of Friends. And again, our League of Friends in the year 2019-20 donated just under £190,000 to the hospital, again providing all of those added extras. You can see here an example. This was some cars that were provided to the children's ward, which helped support and just make it that a bit easier for children who were on their way to theatres to get there, but also to take their mind off the journey down through the hospital on the way. So the League of Friends continue and have continued through the COVID pandemic to support us through the League of Friends shop, and are still raising phenomenal amounts of money to help to support patients and staff here at Yeovil Hospital. I will pause at that point. That's given you a bit of a whistle-stop tour of the year, and we'd be very happy in a moment to take any questions that you might have. I think in terms of the next phase, I mean, clearly we have been since the end of March been dealing with a global pandemic, and I'm going to hand over to Sheila Meldrum. Sheila's our chief nurse, Director of People and Deputy Chief Executive, and Sheila's going to take us through a presentation that sets out the response of the hospital to the COVID pandemic to date.
Good evening. It is evening because it's gone quite dark outside now. I'm going to take you on a bit of a journey through life since March, if I may. So next slide, please. So this is a picture which is a bit of a representation. So you can see this is before we all had to wear masks, but we are socially distancing. This is when we used to be able to see our staff smiling in reality, and they're not behind masks, but they are still smiling behind their masks today. Next slide, please. So really, it's to take you through an extraordinary response to an extraordinary situation. So at YDH, we've been managing really a major incident since the 11th of March. So that was the day on which the NHS declared a national major incident. Now, the last time we did this was for the Beast from the East, when we had a lot of snow. And we're all trained to run major incidents, but usually they only last a matter of hours or days, not the months and months that we've been doing this for now. So what does that mean to us? So that means that we have a control room that's set up and manned. We have a daily COVID-19 huddle, and we've been running that every weekday since March. We also have director on-site cover 7 days a week, and that really is to enable us to have a very real-time view of what's going on in the hospital, to have communications from what's going on outside the hospital, and just to make sure that the hospital is safe and sound, and any action that needs to be taken is taken with immediate effect. That has also included us running a sort of a HR helpline, so that staff can phone in if they have worries about whether they should come to work or not with symptoms, and for us to have a very real-time view of the effect on our staffing. We very rapidly had to look to, in effect, set up hot and cold areas within our wards and departments to make sure that we were protecting patients and staff, and those have developed over time. So that is areas where people come into, and we assess in the first instance whether they have any of the symptoms of COVID. We swab everybody who is coming in as an emergency admission, or and in advance swab those patients coming in for a planned admission. And we follow a pathway through until we're absolutely sure that their swab is negative before we move on to the sort of the colder areas from the hot areas. This has also involved our ED department changing quite substantially. So ED now has a triage process at the front door where temperatures are taken. People are assessed to see whether they have symptoms, and then we work our way through the ED department, again using a hot and cold area approach to make sure that we are not, as far as possible, mixing patients who are symptomatic of COVID with those that are not and are coming in for other reasons. Obviously, from a swabbing point of view, we do, until we've proven that someone doesn't have COVID through their swab, we will treat people using the infection prevention and control measures that are required. We have had to introduce some very stringent visiting policies, and we've implemented those around government guidelines. We have pulled out all the stops, even during the first peak of COVID, to make sure that we did our very best whilst maintaining safety to ensure that people were able to have a visitor or visitors if they were dying. And we've done the same to ensure that women in labour have a partner or birthing partner with them through that. We have changed those and frequently updated those. We are still obviously nowhere near back to having a normal or pre-COVID visiting policy, and that is to maintain safety, because our wards are busy places and we have to really think about the footfall through those wards. We've used technology a lot and encouraged people to use technology to communicate, and we've done our best to assist in all of that communication. We've introduced a lot of PPE, so that's personal protective equipment, and I'll tell you a little bit more about that in a moment because there's some interesting numbers around that. And also within the hospital, we've introduced COVID secure areas. So that's areas within the hospital that aren't in the clinical settings, but are in more of the administrative settings, etc., where we can enable staff to safely remove a mask because we know that they are over 2 meters away from each other, and that we have 10 rules that are in place, which include how people wash their, keep their hands clean, how they wipe down areas. That has enabled us to bring members of staff back who were shielded. But we do also have a lot of staff that continue to flexibly work from home, just so that we can ensure that our areas and our staff are spaced out. Next slide, please. Again, just another visual representation of our team and their resilience, really. We had the clap for carers evenings were really, really welcomed. Our community around us kept everybody's spirits really high. And certainly the picture that's got Jonathan and I in mid-clap, that was a fantastic evening when all of the emergency services and a variety of other people came out. We're all socially distanced, but if you were to pan up to the tower block, you would have seen patients and other members of staff clapping at the windows. And I think that helped to keep people's spirits up. It helped to make it feel like a community responsibility. And certainly all of the key workers and the support workers, as well as our local community, did a fantastic job for us and continue to. Next slide, please. So when we talk about protecting patients and staff, just to give you some view of what we're talking about when we talk about PPE. So a hospital of our size, which is not a huge hospital, we were getting through 18,000 surgical face masks a day. That says YDH usage at its peak. So that was during the initial peak and surge. Well, of course, now we're probably getting through more than that because staff in all corridors, in all clinical areas, etc., are wearing masks. Visitors and patients are asked, if possible, to wear face coverings, but also use the masks. We have mask stations as people come through the doors. 7,500 aprons a day, 35,000 individual gloves a day. And FFP3 masks, about 500 a day. Those are the masks that you will have seen on the news that are very fitted to people's face, to staff faces and can cause some bruising. But I think we did a really good job of making sure that our staff could wear those masks as comfortably as possible. And we were very, very determined to make sure that our staff had the personal protective equipment that was required, and also if we had additional personal protective equipment, to use that within the community to help our partners. Next slide, please. Jonathan talked about earlier the vast number of people that we see through outpatient departments, and we had to very quickly introduce virtual outpatients as face-to-face clinics became a very difficult thing to do. So there was really an introduction of virtual clinics very rapidly. And over those few months, we have seen 25,000 people either spoken to them over the telephone or by video appointment, and that's covered 50 specialties. And that is something we will continue to grow and develop, whilst also making sure that we can safely see people face-to-face who require that face-to-face appointment. And I think that's been very welcomed by people. Next slide, please. We also had to look at our cancer services, because obviously when you're looking at who your most vulnerable patients are, those people having chemotherapy, etc., are in a vulnerable position. And we partnered with St Margaret's Hospice to temporarily transfer our oncology and haematology service from YDH to the hospice site on the 11th of May. This is providing the same quality of care, the same team, just in a safer setting, minimising the risk that I mentioned at the beginning. And we've had exceptional feedback from staff and patients, and we're very grateful to St Margaret's for their help and partnership in this. Next slide, please. So testing, we provide, as I said, we provide testing for all of our patients that are coming in to be admitted through the hospital. All of those patients that are coming in for a planned operation, we will test them prior to them coming into the hospital. But we've also had to put a lot of testing in place for our staff and their household members, in order for us to be able to get staff back to work quickly. So we have carried out numerous tests. These are increasing, and we are currently averaging about 33 tests on members of staff or members of their direct household a day at the moment. That's certainly increased as schools have opened, not surprisingly, and we will see an increase as we see an increase in prevalence in the community. And patients, we've swabbed 3,700 patients. Some of those patients are swabbed more than once, so it's not 3,700 individual patient swabs. Next slide, please. So when it says back to business, I don't think that we're not going back to business as usual, that's for sure. We're going back to a world that lives with COVID, really. So one of the big things we needed to do was to get our elective operations back up and running. We're at about 81% of where we were sort of this time last year. That has restarted. Our target is 90% by the end of October. So we're in a pretty good position with that. Referrals, obviously referrals dropped off during the peak of COVID. People weren't or couldn't access some of the services that they had been able to access. But we've seen that to return to about 80% of pre-COVID activity. Cancer referrals have increased at a greater rate than that. We're up to the point where 96% of patients referred for suspected cancers are seen within 2 weeks, despite that increased referral rate. We fabulously had delivered a CT scanner in a box, so that's a CT scanner that exists within its own building, really, and that was craned into the site a few weeks ago, and will increase the number of CT scans we can do, particularly on outpatients, so increase our capacity to beyond where it was pre-COVID. 75% of our diagnostic tests are taking place within 6 weeks. And we've done a lot of work to double the capacity to be able to discharge people through new pathways, obviously to get people home quicker and in the right place for rehabilitation if that's what they require. And we've avoided about 20 admissions a day by some of the new pathways we have in place. Daily ED performance, despite the fact that our ED is now back up to pre-COVID levels, we are rarely below 95%, which is the national target. And that is whilst we're maintaining a safe department. It does mean we have to work in a different way. It does mean that relatives can't, other than for children or those people who are terminal, but relatives and things can't come into the ED department because we have to socially distance. So back to a new type of business, I would say. Next slide, please. I think that's it from me.
It's okay? I beg your pardon, I was muted. Thank you, Jonathan and Sheila. Please remember that if you have any questions on what you've heard, do put them into the system and we shall respond to them later. It'll be a few minutes before we come to the question and answer session, so you've got time to think them up and to give them to us. What a year it's been, what an extraordinary time it's been, and how busy everybody has been here. And for that, of course, we're all extremely grateful to the staff, volunteers and others who make it all happen. Our next item on the agenda is to consider the lead governor's report as circulated. I'm always very grateful to the governor's support. It's very helpful. Their input keeps us on our toes. And I should say that on the governor's behalf, they would really like to hear from you regularly if you have any issues or thoughts that you'd like them to bring back to us. They are a conduit. They're your representatives as members of the Foundation Trust. So do contact your governor if ever you want them to take up an issue for you or bring it to us. So if I may, we should note the report from our lead governor, Alison Whitman, and I'm very grateful to her for the support and contact she gives me. The report is complimentary and kind, a great reflection, I think, of the good relationship that we on the executive and non-executive have with our governors. And it's important that we note that. I don't think there's a vote required for that. I think all we are here to do is to say the governors are active, the governors are engaged, the governors would like to hear from you if you'd like them to carry anything through. We enjoy our relationship with our governors, and thank you very much for that. And thank you, Alison, for your report. So moving on then to the formal business, there are two pieces of voting to be done. The first is that we have to receive the annual report and accounts as published on our website. It's a long document, an awful lot of work goes in by a lot of people to produce it. It gets placed before the House of Commons, so it's an important document. And what I need to do now is to ask the members that they would confirm on our poll system that you're happy to do that. The poll is now open, and I'll give you a moment to vote. You're all finding your buttons. How are we doing? Okay, we have the results, and I'm pleased to say that the annual report and accounts have been received by the members. Thank you very much for that. Our second piece of formal business relates to the trust constitution. And this is a bit a COVID situation. What occurred was that we received some advice that we shouldn't hold governors' elections, and the consequence of that was that we then became potentially inquorate, as the lawyers would put it, which would have meant that if we'd allowed that to happen, the hospital would have been frozen in action, which would have been a bit of a disaster in the COVID situation. So the paper was produced and the constitution was changed. That now has to be approved by the members, and I hope that the paper is clear. I should thank Ben, our company secretary, for making that all clear. And I can tell you there's a consequence. It kept us going when we would otherwise have been inquorate, because we had governors whose time was up. They're all now re-elected, and we have a full complement of governors once again. Anyway, could I now please ask that you vote on whether or not you accept and approve the changes to the Trust Constitution. The poll is now open. How are we doing? You've got the replies, and is that accepted, Ben? Okay, so I'm very pleased to confirm that change to the Constitution is also accepted. Thank you all very much. So this is the point when I now pass over to Jonathan and invite our executive team to join us, and we shall endeavour to answer your questions, and I will hope that they will all now come up. So Jonathan, can I pass the control over to you, please?
Of course, and this is a new experience for us all, so we'll try our best. We should start to see members of the exec team appearing on the screen, and I would encourage people to post questions, and I'll refer them probably to the most appropriate person. But it'd be good if when we do that, if people can introduce themselves and say what their role is, and then it might become obvious why I'm fielding questions in a particular direction. There's 3 questions there at the moment, so I would encourage people, please post questions for us. We're very happy to answer questions about the content of what you've heard, either through the year 2019-20, or actually also our response to the pandemic. But just to get us going, there's a couple of questions. So the first one is a financial question. So I'll refer that to Sarah, who's our Chief Finance Officer. But I might just, in terms of the question itself, is what does the receipt of the 19.3 million from NHS-E and I now allow you to progress with in relation to future ambitions and objectives? So Sarah, I don't know whether you want to pick that up.
Yeah. So unfortunately, the 19.3 million isn't money that's given to us to actually spend on something. It's given to us, well, was given to us last year to offset costs of the normal running of the hospital, which had already been incurred during that year. So if you recall, we ended the year in a deficit position, but because we'd hit the target we were set, we were then given money to offset that deficit. So that was actually to cover existing costs. You could say that in general terms, it helps us maintain our financial stability. So provides a kind of a foundation for us to allow us to progress some things that we would want to do. It doesn't actively give us money with which to do so.
Thank you, Sarah. And I think it's probably fair to say that as we move forward as well in terms of this financial year, the financial regime by which the NHS is living within has changed quite considerably since March, enabling us to cover our costs for the first part of the year, and the additional costs have inevitably been experienced as a result of our response to the COVID pandemic. I think as we move into certainly the second part of this financial year, but into next year, so into the financial year 21-22, we're just kind of assessing the impact of all of this on the kind of recurrent position and the budget for the hospital moving forward from April 21. Then there's a question about the impact of COVID on the ability to evolve and develop system-wide delivery models. And it might be that I ask Simon just to cover that off. I think, from my perspective, one of the positive impacts of COVID has actually been the very, very swift and innovative way that the systems come together to deliver models that have both supported discharge from hospital, but actually now very much focusing on our recovery and the way that we're managing waiting lists as a system across Somerset. But I'll hand over to Simon Settee, who's our Chief Operating Officer, just to give a bit more of a flavour of that. Simon is muted at the moment, or we can't.
Simon, we can't hear you.
We might be having some technical issues. I can do my best to try and cover that off. So, I alluded to two things. I think COVID has had a significant impact on our ability and the innovation that's come together as part of a system-wide model. And I'll give you two examples. So one has been the development and the further development of our integrated and intermediate care service across Somerset, which is now supporting patients to be discharged from hospital into care settings for ongoing assessment of their future needs. That's had a massive impact. It had a massive impact on day one, really, of our COVID response in terms of us being able to move and transfer patients to alternative care settings where they were safe and they were able to receive care in a really different way. So that's one example, really, of where both health and social care have come together to support the most complex people in our community. But secondly, we've seen a response now particularly around our elective recovery, around our planned care recovery. One of the consequences of the COVID pandemic has been that we put on hold a large amount of our routine operating. And we've come together now as a Somerset system to think about and start to provide services together in a way that we can equitably move forward and equitably provide care to those people who've been waiting for extended periods of time, focusing really on clinical urgency as a first area. And we're working with Musgrove Park Hospital on this. One area that we're specifically working on is ophthalmology. and looking to see how we can make use of the ophthalmology capacity that we've got, that we've grown here in Yeovil, to help support reduction in ophthalmology waiting times across the county. But I think, again, as time goes on, there is a massive amount of opportunity for us to work collectively across our system in Somerset to deliver new ways of providing care. The rest of the team seem to have frozen on us here, but I'll keep talking. And the third question is, what is the current position of COVID patients in the hospital? We have, and I think through the recent weeks, we've had a low number of COVID presentations in the hospital, and certainly over the summer. That has started to increase slightly in recent weeks. So increasingly, we've had 1 or 2 presentations every day for the last few weeks. So we're definitely seeing, it's a low level, but we're definitely seeing an increase in presentations to YDH, which I think is reflective of what's going on in the local community. Those are the questions that are on there at the moment. Do we have any other questions that anybody wants to post or ask at this point in time? I encourage you, this is your opportunity.
Maybe we have told you so much.
All right,
the questions are low.
So Ben's saying there are more questions, but we can't see them. Okay.
How do you see the future of the Kingston wing?
Okay, so a question about the future of the Kingston wing. The Kingston wing is our private patient unit, and within the COVID pandemic, we have utilised the Kingston wing in a different way, because it's the one facility within Yeovil Hospital that is all single room. So at the point at which we were dealing with our peak of the pandemic back in April and May, we were utilising the Kingston wing as an area to isolate suspected COVID patients. And I have to pay tribute to the staff up there who absolutely changed and adapted the way that they provide care phenomenally and almost overnight to go from an elective private patient unit to being right in the front line of our COVID response. We are working now, and again, that capacity is still required in that way to support our COVID response. We've started to step the Kingston wing back up again on Ward 6A, where we've got dedicated beds for the Kingston wing, and have started to re-provide our private patient outpatient facilities as well within the footprint within the Kingston wing. So we're on a journey to trying to get private patient operating back fully again, working with the clinical teams to do that, but balancing that with the COVID response and the need to utilise facilities for infection control and keeping our patients safe.
What is the justification for the millions of deficit that was mentioned?
So good question about the historic underlying deficit of the hospital, and we during the course of 2019-20 asked that question specifically. So what were the drivers? What were the underlying reasons for the deficit in both at Yeovil Hospital, but also across the Somerset health and care system, which I have to say is not that much different from every other system across the southwest. It boils down really to 2 things. One, about half of that deficit relates to what we've determined as structural things about the way that we provide our care in Somerset, which enables us to say, actually, again, through the question around could COVID enable us to evolve new ways of delivering care models? The answer to that is definitely yes, and there are a number of areas where we are looking to see whether there is a more partnership with Musgrove Park Hospital and Dorset County Hospital, and actually critically also community services, which means we're able to provide care in a really different way that both improves the quality of care, but also the unit cost of care as well. So that's half of it. The other half relates to our geographical position and the need to provide a full range of services here on the Yeovil site because of the geography of Yeovil Hospital. Sometimes those services are described as being subscale in that they could provide care to more patients, but because of the geography, we need to be able to provide them in this location. So that, and part of that was recognised in this assessment of the additional income that so the 19.3 million that has been allocated to us nationally was a response to the fact that actually our unit cost in a geography like this is going to be higher for some of those services, but also in recognition to the work that we're doing around providing new and different care models, which over time will have an impact on unit cost as well.
What do you consider to be the 3 key challenges for the year ahead?
So that's a really good question, and I wish in a way that the rest of the exec team hadn't all frozen on us here at this point. They're still there. People are still there, but we can't hear them. Can we? Okay.
People are still there. They can hear us. Our camera's broken.
Okay. Okay. So 3 key challenges for the coming year. Well, clearly having a safe winter, I think, is key challenge number 1, and being able to deal both with a historic winter that sees increased presentations anyway into the hospital, but layer onto that the challenge of increasing COVID admissions as well, and making sure that we're able to balance that with the needs of other patients, so the cancer patients, the patients waiting for elective treatment. I think operationally that really is encompasses the biggest challenge that we've got. And I think within all of that, keeping our staff safe and well and supporting them through what will be inevitably a tricky 6 months, not just because they're doing a job in the hospital, but I think for every person that works here, the impact on their personal lives in the same way as the impact on everybody's personal lives has been significant. So, this isn't, as Sheila said, it's not like managing a major incident of snow or something like that, where within a few days it's over and you might come to work, but actually family life is fairly stable and the same. Actually, we're trying to manage and support our staff, both to deal with difficult jobs and to recognise that they have each person has an individual context, an individual set of worries that they are dealing with outside of that. So I think for me, there probably aren't 3, there's probably 2, and the 2 are the winter and keeping staff morale high whilst we go through that. I think the rest of my colleagues have frozen on the screen here, but I think I understand people can still hear them. So I don't know whether anybody wants to add anything to that. This could be a bit of a free-for-all because I can't see anybody. Sheila wants to say something.
Yeah, I would say just to add to that, that resilience thing is that obviously in the slides that you did, Jonathan, we talked about our number of overseas members of staff, and I think life is particularly difficult for them, not only because they're trying to judge what's going on in their country of origin, but they also can't visit home in the way that they used to. So I think that's a bit like we struggle to go on foreign holidays, etc. I think it is particularly difficult for those staff. So our energies and effort in supporting the well-being of those members of staff and understanding quite what life is like for them, I think it is key over, it has been key and it needs to continue to be a focus.
Thank you. Anybody else want to come in?
I was just going to say, Jonathan, I don't know if this is working audio-wise.
Yes, no, it is working audio-wise. It's just the video screen. Yeah.
Obviously, one of the transformations of COVID has been the digital journey we're all on. So that's been very positive. I was just going to echo, I think the third bit, if I was going to add to that, would be about the elective recovery. And that links to the earlier question about opportunities. So obviously, some of our patients have been waiting longer than we'd like, and we want to try and get as many of them in as possible now. And looking back, particularly at the last few weeks, our elective activity has really increased, actually almost close to pre-COVID levels. And so that would be one of our key priorities, is how do you balance the increasing winter demand with seeing the patients who've waited to get diagnostics and treatment.
Thank you.
Okay.
Any further questions?
Ben?
Okay, thank you.
So, thank you all very much for those questions. I hope that's helped broaden the view of where we are. It is very difficult times, but it's also very busy times. And I can only tell you that we had a board meeting today where we covered an awful lot of subjects, but we started by saying winter isn't coming, winter has come at the moment at Yeovil. We are having a huge number of attendees and we're doing our very best to help. So it is a busy time. And I should like to close really the meeting by saying a lot of thank yous, because this stuff doesn't happen without huge effort and huge personal commitment. And I'd like to start by doing the obvious, which is to thank all our staff who have soldiered on through both normal hectic times and in particular through the extraordinary times of this pandemic. Sometimes people suggest that the South West has had it a bit easier, but every day different members of our team don their protective clothing, take their hearts in their hands and head out into the minefield of the pandemic. I take my hat off to you all. This takes great courage and resilience. Thank you very much for your determination and persistence in the unrelenting pressure of it all. I wish you all the good health and energy that you need to keep going. Secondly, I must thank our executive leadership team. Maintaining confidence and morale in the face of the current situation is very tough. It takes deep reserves and firm commitment. The leadership team given by Jonathan, Sheila, Mary, Simon, Sarah and Jeremy is outstanding. We owe you a debt of gratitude. Thank you very much for all you do. There are then our non-executives who've given support and challenge, advice and guidance to our executives, and on all our behalves held the executives to account. Jane Morris, Martin Graham and Paul, you do this with ease and the right touch. Thank you very much for your help and support. As I've said, my sincere thanks go to our governors for volunteering their time to help this hospital thrive and to maintaining a dialogue between our members and the hospital. And indeed, of course, my thanks must go to all our volunteers, without whose enormous help this hospital would struggle hugely. The amount of time and effort that is given freely to ensure that the care we can deliver to those of you who need our help is unbelievable, and we're eternally grateful for it. Of course, our thanks must go to Ben and the team who've put this together today. We have managed to get through a very different annual general meeting to one that I've ever seen before, but I hope it's been interesting. I hope it's informed you, and so thank you very much, Ben. And finally, thank you, all our members, for supporting us and placing your trust in us and encouraging everyone to keep going. This is an exhausting time, and knowing how much the population we serve appreciates the efforts that are made every day by so many different people here at Yeovil Hospital is a wonderful encouragement to everybody. It helps people get up. To start with, the adrenaline flowed and kept everybody going very easily. But my goodness, one gets exhausted and fatigued by it. And the constant encouragement and the constant knowledge that we're making the difference to the population of South Somerset and West Dorset, who we serve, is a wonderful encouragement to everybody. So thank you all very much for your continued support and encouragement. And with that, I would like to thank you all for joining us this evening for the AGM, and I formally close the meeting.